Mr. President, tomorrow we're going to vote on two different visions of how to cover the cost of health insurance on the Obamacare exchanges. Democrats want to cover the cost of health insurance to benefit insurance companies. And I will tell you why I'm saying that, because I can make that case. And Republicans want to cover the cost of health insurance for the actual person buying the insurance, the patient, if you will. Mr. President, that's the difference between the Democratic plan and the Republican Health Care Freedom for Patients Act. So let me just kind of build that out. How do we make health care affordable again? First, Democrats want people to pay $6,000 out of pocket before the insurance kicks in. Republicans want to put thousands of dollars in the patient's pocket so she has that to pay before she actually gets into her deductible. Is this it? And let me demonstrate with this chart. The Democratic plan is to give 100% of the money to the insurance company, of which the insurance company takes 20% for deductible, for profit and overhead, and then uses the rest of the 80% to pay for the insurance that they think, that they agree the patient needs. Our plan puts the money in the patient's purse, her pocketbook, his wallet. 100% of the money in there is used for the care she knows she needs. Doesn't have to get permission from the insurance company. She knows she needs it. She can see her doctor, her dentist. She can get her pharmaceuticals. She can get eyeglasses, dental care, and orthodontia. That is a patient-driven account. Now, this is the plan that Senator Crapo, the finance chairman, and I proposed. So let's compare the two plans. Again, two competing visions, two different ways. And I would argue that the Democratic plan principally benefits insurance companies, and the Republican plan is there to benefit the patient. Let's look at this. Democrats just want to extend the enhanced premium tax credits. Who gets the money? Insurance companies. Under our program, where the money goes to the patient and their families get it. What can it be used for? The enhanced premium tax credit that the Democrats wish to extend, no changes whatsoever, 3 years, subsidizes premiums. That goes to the insurance company. On our side, the money that the patient gets into that account, the money that we put into her pocket so she can pay the out-of-pocket for the insurance company, it goes for real care. The dentist, the physician, the glasses, the prescriptions. Who makes the decisions? Under the Democratic plan, the insurance companies make the decision. Under our plan, the patient makes the decision. We give power to the patient, not profit to the insurance company. Does it lower cost? Clearly not. What we've seen since Obamacare has passed is costs explode. We continue to have the health care inflation we're looking at now. But if we empower the patient, and if we give her the money, and we say the more careful you are spending this money, the more that money is going to stretch. I can promise you, she's going to be like every other responsible wife, mother, keeper of the family wallet. She's going to shop. Wait, my x-ray is $50 here. No, my x-ray is $500 there. I'm going where it's $50. She will make the wise financial decision for her family. And how does it work with low-cost bronze plans? Here, under the Democratic plan, we have just heard Senator Crapo point out how much fraud there has been with this system that we're currently under. Under the patient-driven account, the money goes into a health savings account, into your wallet, if you will, which is connected with your bronze, and the mechanisms by which we set that up make sure that we can cut out that fraud. And our bill goes after their fraud. Their bill tolerates it. There is nothing in their legislation to stop the fraudulent stealing of billions of dollars of taxpayers' money. What it does do is continue payments to insurance companies who take 20% of that money for overhead and profit, whereas under our plan, did I say, the money we give to the patient, 100% goes to the care she knows she needs. That's the plan that Republicans are proposing. Put it differently, under the Republican plan, there is power to the patient. Under the Democratic plan, there is profit and power to the insurance company. Under the Republican plan, the patient uses the health care in her wallet, the health care money in her wallet to purchase the care she knows she needs. Under the Democratic plan, you go to the insurance company and please, maybe please, can I get permission to get the care I know I need? The Republican plan meets the American people where they are financially. Studies show that that most families have less than $1,000 worth of savings. Under our plan, we recognize that. And we put money in their wallet, pocketbook, or purse so that they can pay for the care they need before they go into their deductible. I like this. This is a new poster for people who've heard my talk before. This is the Democratic plan. You get a $6,000 deductible, and that's what you feel like that woman right there when she is stressed because she doesn't have the money to pay for the care her family needs. Here, in her health savings account, the money is, if you will, in her purse. And when the doctor says you need this prescription for your son's earache, she has the money to pay for it right off the bat. Democratic plan, it brings financial stress. Profits to the insurance company, stress to the patient. The Republican plan, money in the pocket to pay for the out-of-pocket for the insurance plan. Now, by the way, this plan in which we put money in the pocket of the patient to pay for the out-of-pocket of our insurance policy, the Democratic leader has called a junk plan. Now, pause for a second, Mr. President. Democrats put that plan into place. Democrats actually put these plans on the Obamacare exchange. He is calling a junk plan that which they have been preserving for the last 10 years, swearing up and down that it meets the needs of the American people. All Republicans have done is added to it something called a health savings account. If you will, money in the patient's purse, pocketbook, or wallet to pay for the out-of-pocket associated with this plan. To call this a junk plan either shows that the Democratic leader does not know what we're talking about, or that hypocritically he has been defending an Obamacare law which created this very plan. By the way, I was smiling last night when I saw that the New York Times mimicked this talking point like a Democratic Party organ. What's junk? That for a family of four, two parents, in their 50s, children 18 and 19, that they would get $5,000 a year. Think about that, Mr. President. $5,000 a year for that family I just described to pay for their initial health care expenses. Think about if one of those 19-year-old children had diabetes, chronic care. Under our plan, they've got $5,000 to help pay for that chronic care right off the bat. Under the Democratic plan, with a $6,000 deductible, you're paying for that out of pocket. And that's what your face looks like, because you cannot afford it. Our plan relieves the stress. Now, next, the minority leader says that he wants to reject all these benefits. He wants to continue to send 100% of the money to the insurance company, which takes 20% for profit and overhead, as opposed to send the money to the patient for her purse, wallet, or pocketbook, so that she has money in her pocketbook to pay the out-of-pocket from the insurance company. He's defending that with a $6,000 deductible because he says that Republicans want to prevent taxpayer-funded abortions. He wants to have taxpayer-funded abortions, apparently, and Republicans, consistent with the American will, as we have for decades, think that we should not do that. And somehow he's making out like this is a new development. Well, just for the sake of the American people, the so-called Hyde Amendment, which prevents federal dollars from being spent on abortion, has been agreed to by Democrats on annual appropriation bills since the 1970s. They have been agreeing to this for 50 years, and all of a sudden that is being used as a rationale to send 100% of the money to the insurance companies, who take 20% of it for profit and overhead, as opposed to sending thousands of dollars to the patient for her to pay first dollar coverage, to have it in her pocketbook to pay the out-of-pocket for her insurance plan. Mr. President, I don't want this to seem partisan. I've been saying Republican and Democrat, but let me say, we should not have a Republican plan. We should not have a Democratic plan. We should have an American plan. This is the cartoon representing an American. But think of the person you know. Think of the person you graduated from high school with. Good people, good people. Several kids trying to make ends meet. They don't have a lot of money, but good people. That's what we're talking about. Let's just separate this from R versus D. What about the people we are supposed to care about who cannot afford a $6,000 deductible, but would love to have thousands of dollars in their purse, pocketbook, or wallet to pay for the out-of-pocket cost associated with that insurance plan? Isn't that where we want to be? Now, just to put a face on this, maybe some numbers I should say, this is real. This is off healthcare.gov from 2026, this coming year. A family of four, couple in their 50s, two children, 20 and 21, 500% of federal poverty level, about $160,000, I think, per year. Okay? Under our plan, they would be able to get a bronze plan as opposed to a silver, which saves them roughly $6,000 per year. The amount in their health savings account, if you will, in their pocketbook, purse, or wallet, in their pocketbook to pay the out-of-pocket cost of the insurance plan, would be $5,000. Under what Democrats are insisting they must buy, will not give them an option. They have $0 to pay towards that $6,000 deductible. And the net deductible, because they say, oh my gosh, if you get a plan with a lower premium, your deductible is higher. Because of the money that would be going into the health savings account, the net deductible is cheaper with the cheaper policy under the Republican plan. Under the Democratic plan, the net deductible is higher. Let me add one more thing. Senator Crapo spoke about the incredible amount of fraud associated with the current implementation of Obamacare. And the Democratic leader wants a straight-up, clean reauthorization for 3 years. He does not want to fight that fraud. Whatever bills have put up in the past, that's not what he's talking about now. He's talking about right now, not only 100% of the money going to the insurance company with $6,000 deductibles, he's talking about continuing the system that is rife with fraud. If you're at home working, or no, if you're at work and you're working so hard and you're paying taxes to support our country and you hear there's fraud, it should drive you crazy. It drives me crazy. Why won't our Democratic colleagues join us in doing things to stop that fraud? I've never seen a party so committed to generating profits for insurance companies as what I'm seeing right now. Mr. President, let's cut that fraud. Let's put the money in the purse, pocketbook, or wallet of the American citizen to give her money to pay for the out-of-pocket cost of an insurance company. Don't stick them with a $6,000 deductible. Let's give power to the patient, not profit to the insurance company. And with that, Mr. President, I yield.